Thank you, Sean, and thank you, Harry and Julie and the whole TB HIV care team. It's a great honor to be here. I'm delighted to have this opportunity at what feels to me like a real moment of opportunity in South African drug policy, where the debate is finally opening up and change is beginning to happen. We heard yesterday about the rollout of OST, and obviously you've had the Constitutional Court case with Cannabis. Clearly there's a long way to go, but there are signs of change, and it's fantastic for me and my organization to be able to be here at this moment and feed in our experience and some of the experiences of our international colleagues on this one particular issue of regulation, which is what I'm going to be talking about. So my organization, Transform, we've been around for about 20 years, and we're an NGO focusing on drug policy and law reform, with a particular focus on regulation. So we began, and our focus was always about how to end the war on drugs and what comes after the war on drugs. So we've been very focused on not just critiquing the problems with current policy, but trying to come up with and present a vision of an alternative approach. So you can see here there's the Alternative World Drug Report that we produced. This is a thematic sort of critique of the problems of the war on drugs internationally. And all these reports, as Sean said, are available to download on the Transform website. But we've also come up with these detailed models of what regulation means, because it's easy to just say, oh, the war on drugs has failed, we should legalize drugs, but that's not enough. If you want to get policymakers to buy in, if you want to get the public to understand what you're talking about, and if you want to get the media and other public voices to talk about it, you have to have a clear, coherent vision of what the alternative is you're proposing. So we have produced these models for discussion. It's not going to work for everybody, it's not going to be perfect, but we've produced something detailed and coherent to allow the debate to move forward. So Blueprint for Regulation focuses on drugs generally. We've also produced a specific book on cannabis regulation. And at the end, you can see we also produce advocacy guides. So not just the sort of detailed textbooks for policymakers, but also how to talk about these issues, because they are difficult issues. If you're talking about dangerous, risky drugs, and you're saying, yes, we would like to legalize and regulate them, that's a very counterintuitive position. It's very difficult for some people to get their heads around it. It's like, well, they're like, drugs are dangerous. You want to legalize and regulate them? Are you crazy? Well, no, we're not, but people are worried about this idea, and we need to be able to talk about it in an intelligent, sensible way, and engage people where they are at. We need to deal with their concerns and respond to them in a meaningful way. One of the things we do, and I just want to briefly highlight, we have an initiative called Anyone's Child. So we don't just do the sort of dry, technocratic policy work, we also tell stories, because one of the ways to engage the wider audience is to tell stories that they can relate to. So we have a group called Anyone's Child, which is about families who have been impacted by the war on drugs and or have been impacted by drug law reform. And these groups, they come from all over the world. We have Anyone's Child groups in Latin America and North America, and there's a picture here on the right of our Kenya-based Anyone's Child group. And it's been a very effective way of engaging certain popular media and engaging the wider public in a way that, doing statistics and graphs and policy analysis, it can't reach the wider public. So telling stories is a very useful way for us of getting the debate out there, getting these ideas out there in an approachable way. And we're very keen to start Anyone's Child group in South Africa, if anyone wants to talk to me about that afterwards. Just a bit of context. The debate, when we started 20 years ago, the drug policy, the idea of legalization and regulation of drugs was very sort of marginal. It was very fringe. We were seen as quite an extreme group. Even my mum thought I was crazy when I started working for Transform. But things have changed. And 20 years ago, no one had legalized and regulated anything. Even when the Global Commission produced their first report in 2011, no countries had legalized or regulated anything. But now, and I think the Global Commission is a remarkable symbol of how the debate has evolved. It's not just people like me going anymore. We've got I think two words sum it up: Kofi Annan. We have the former General Secretary of the United Nations, is a member of the Global Commission, and is advocating, or unfortunately he died earlier this year, but advocating for regulation of not just cannabis, but all drugs. And it's not just Kofi Annan. I've put we also have Joyce Banda, who's a former president of Malawi, and President Obasanjo, former president of Nigeria. And that's just the African members of the Commission. There's also, I think, another 10 former heads of state of Colombia and Brazil and Chile. I can't even remember them all. Poland, East Timor, New Zealand. These are big-name, high-level, important people, and they symbolize the fact that the debate on regulation has moved from the margins of the political debate to the mainstream. And it's not just that it's now mainstream, it's also moved from theory to reality. So it's not just a few people smoking a joint going, yeah, wouldn't it be great? This is actually happening around the world. And if just look at what's happened since 2011 when the Global Commission made their initial call. In 2012, Washington and Colorado became the first jurisdictions anywhere in the world to legalize and regulate a prohibited drug, in this case, cannabis. In 2013, just a couple of months later, Uruguay became the first member state to legalize and regulate cannabis. That same year, 2013, New Zealand introduced its novel psychoactive substances regulation bill. This was a legal regulatory structure for regulating synthetic drugs. It's kind of become a bit of a mess. It hasn't quite worked out. But nonetheless, this was the first time any country tried to legalize and regulate drugs other than cannabis. That same year, Bolivia introduced a legal regulation model for the coca leaf which contains the cocaine alkaloid. Now, they didn't legalize and regulate cocaine, but they did legalize and regulate coca. So this is just to stress it's not just about cannabis. Other countries are having the regulation debate around other drugs as well. In 2014, Alaska, Oregon joined Washington and Colorado in legalizing and regulating cannabis. In 2016, Nevada, Maine, and Massachusetts joined, and California, the 6th biggest economy in the world, with 60 million people, legalized and regulated cannabis. So it's now, I think, around a third of the US population has access to legalized and regulated cannabis. In 2017, hang on, that's not right. That's 2016 as well. Sorry, apologies. 9 member states talked about and advocated for regulation at the UN General Assembly Special Session on drugs. And in fact, that special session was called by 3 countries, Guatemala, Colombia, and Mexico. And in their statement, they challenged the... Oh. That's better, thanks. They challenged the failings of the war on drugs and called for a discussion on regulation. There were many other things I could have put on here, but I haven't. There's all kinds of reforms progressing in the Caribbean. Jamaica has legalized cannabis for religious use. I'm not quite sure what religious use means. I'm an atheist. It seems a little bit unfair. Anyway, Jamaica is moving forward. Antigua has just announced that they're going to legalize and regulate cannabis. Barbados is legalizing and regulating cannabis. There was a CARICOM, Caribbean Commission, that advocated for moves towards regulation. And in Europe, there are 4 or 5 countries that are very close to making the move forward on cannabis regulation as well. Denmark, Switzerland, Spain, Italy. Reform is happening all over the world. New Zealand next year are having a referendum, a national referendum on cannabis regulation. Now, a lot of the action is around cannabis. That's not surprising. Cannabis is one of the less risky drugs. It still has some risks, but it's amongst the drugs, it's less threatening to the public. It's the most widely used of the illegal drugs, and it's particularly difficult to enforce prohibition against cannabis because you can just grow it anywhere. But it's not just cannabis, and I hope this list shows that to be the case. We've looked at, there's MPS regulation, there's coca regulation, and of course there is regulation even of the most dangerous drugs. So heroin, for example. A number of countries around the world now prescribe heroin to dependent heroin users. Now, is that legalization? Well, no, it's not, because medical use of drugs is legal under the UN drug conventions. But it is regulation. These are people who were using dirty heroin with dirty needles and injecting in back streets and committing crime to buy that heroin, and they were buying that heroin from an illegal market that can be traced back to Afghanistan or Mexico. And now they are using pharmaceutical heroin prescribed to them by a doctor that is produced and grown in Tasmania and Spain and even in the UK. The UK is one of the biggest producers. It's the biggest producer of legal heroin in the world. The UK, my country. Who knew? So proud. And of course, this year we've had the South African Constitutional Court decision that has effectively decriminalized personal possession, use, and cultivation in the home. So there is change happening all across the world, and we need to be ready for that discussion to talk about it. Because regulation is now a core part of the drug policy discourse. Whether you agree with it or not, it is there. Multiple countries are doing it. It's a regular topic of discussion in the highest level forums. Heads of state, both former heads of state and now serving heads of state, are openly advocating it, and multiple countries are doing it. So we need to be able to talk about regulation in an intelligent, coherent, and positive way. Now, I want to be clear that regulation is only one part of the drug policy jigsaw. It's not going to solve all the problems. It's not everything that we need to be concerned about. Clearly, there are also issues around service provision, around prevention, around treatment, around how we help key populations, and so on. But regulation is a key element of the debate, and we need to be able to talk about it in an intelligent way. I think it's also important to be clear that different countries and different regions are at different stages on this drug policy reform journey. So it's all very well for me to stand up here and talk about regulating drugs, but in some countries, the priority may be just to stop some of the horrible human rights abuses and ensure basic access to services. So in the Philippines, where there are thousands of people being killed in a brutal war on drugs, the first thing to do is to stop that happening. We need to stop people being killed. We need to stop people being executed. We need to secure fundamental human rights in many places in the world. But, as I said, regulation is a key topic of debate, and we need to be able to talk about it intelligently. I think it's also important to ask, what is it we want our drug policy to deliver? It may seem like an obvious question, but if you look historically at prohibition and the war on drugs and drug policy, it's often very narrowly focused on creating a drug-free world, ridding the world of drugs, which is in many ways quite a strange objective, because even for the advocates of a drug-free world, that is really a means to an end. And the end that we all share, whether you're an advocate of prohibition or you're an advocate of regulation or you're an advocate of something else, these are the basic goals, I hope: to protect and improve public health, to reduce drug-related crime, corruption, and violence, to improve public security and human development, to protect, in particular, young people and vulnerable populations, to protect and enhance human rights, and to base policy on evidence of what works and what provides good value for money. Now, it may seem obvious, these seem obvious, everybody agrees with this, but it's still important to lay them out. Because once we do that, everybody agrees on this. Whatever your position, everybody can agree on this. And once we can agree on this and we have some common ground, we can then say, is the war on drugs delivering these things? And I think the answer is no. On all of those things, the answer is no. Would decriminalization regulation be better at delivering these goals? I think yes, it would. And that's at the heart of the argument for regulation. I think it's also important to be clear about language and the concept of regulation. What do we mean when we say regulation? There are many misconceptions around the regulation debate. People say, if you legalize drugs, then we will have heroin and cocaine and methamphetamine in the corner shops and supermarkets of every street. That is not what we're talking about. Regulation, and Michel was talking about this very, very eloquently yesterday, regulation is about the management and reduction of risk. Risky products and risky behaviors. And as Michel was very clear about yesterday, regulation is one of the primary functions of government. It's what we elect governments to do. And everything around us is regulated, from cars to the electrics in this lighting to these sweeties. These sweeties you have on your desk, every ingredient in these sweeties is regulated. There's a sell-by date on here. It's regulated. There's a listing of ingredients, so you know exactly what is in these sweeties. Even these sweeties are better regulated than the drugs that you buy on the streets that people are injecting or taking into their bodies. So regulation is not a free market. Regulation is not a libertarian position in terms of libertarian economics. Regulation is not about relaxing or liberalizing our approach. It's actually about rolling out the state to regulate products that at the moment are completely unregulated. They are currently in the hands of organized crime and street dealers. So what we're really talking about is this one group of products that has historically never been regulated. We're talking about just bringing it back within the sphere of control of government, where it can be regulated like everything else, And the motive is about protecting the public. It's about protection and risk reduction. Whereas at the moment, the motive of the market is about profit-making for organized crime. There is no single regulation model. Different drugs would be regulated in different ways and in different countries. So there isn't like one magical solution. There is a whole range of different approaches that we can adopt. But regulation is about deciding the parameters of what is allowed and what is not allowed. So regulation doesn't mean everything is allowed. We would not, for example, allow the sales of any legal drugs to children. We don't allow that for alcohol and tobacco. We wouldn't do it for other drugs in the future. So it's about establishing what is allowed and what is not allowed, the parameters, and things that take place outside of those parameters will remain prohibited. So if you don't put a sell-by date and you don't put ingredients list on your sweeties, you're not allowed to sell them. That's what regulation is. It's not a free-for-all, and it's not free market economics. In terms of what we can regulate, again, in many ways, this seems quite obvious. We regulate all aspects of the market in the same way we do with every other product. So we can regulate the production and the transit of drugs. We can regulate the products themselves, their dosage, their preparation, their price, and their packaging. We can say you have to put health warnings, ingredients listings, sell-by dates. We can regulate the vendors. Who is allowed to sell these products? How are they made available? Should they be licensed vendors? Should they have certain training requirements? Again, these are things that we can regulate. We can regulate the outlets. Where would these drugs be sold from? The location of the outlets, the appearance of the outlets, their signage, the hours of opening, for example. We can regulate the marketing, things like advertising and branding and promotions. So we've seen with tobacco control, for example, you used to be able to brand and advertise and promote tobacco, and the law has changed. I think in South Africa too, you have your new tobacco control law. In the UK, now we have unbranded packaging. It's in a sort of horrible pukey green packet, has a picture of a horrible cancerous lung on it, and you can't advertise cigarettes. They're sold from under the counter. You can't even display them. They're not illegal, but you can't promote or brand or market them in any way. And finally, we can regulate the buyers and users. Who has access to these products? Who has access to this market? Most obviously, that would be the idea of age control. So for any legal market, we're looking at adult-only access. And I think it's important to remember that we have this big flexible menu of regulatory tools, and there is an enormous body of scholarship and expertise in how to use these. From alcohol regulation scholarship, tobacco regulation, pharmaceuticals regulation, but also regulation of other risky behaviors and products. So risky things like regulation of gambling or regulation of sex work or regulation of all manner of risky activities. We are actually quite good at regulating things. So again, it's simply a matter of applying that knowledge and that logic to a group of products and behaviors that historically has never been regulated. But just going back, and the point that Michel made yesterday, I want to reinforce that it's a fundamentally pragmatic position. It's not to call for regulation is not to say I approve of drugs or I think drug use is okay. Regulation deals with reality, and the reality is that millions and millions of people use illegal drugs, whether we like it or not. Many people don't like it, but as policymakers and as responsible citizens, we have to deal with the reality of the world as we find it, and in that world, millions of people use illegal drugs. We can't just abandon them, we can't just forget them, we have to regulate to protect them and reduce the risks they face. It's a fundamentally pragmatic position. Either governments control the drug markets or criminals control drug markets. There is no third option in which the drug markets will magically disappear. So it's a choice. We have a choice. It's government or gangsters. We have to decide. In terms of what regulation would look like for different drugs from a consumer point of view, Transform has identified 5 models for regulated availability. And again, Michel alluded to some of these ideas in his talk yesterday. And you can see for different types of drugs associated with different levels of risk, you would have different models of regulation. So going from 1 down to 5 on this list, the top ones are the most risky drugs and the most restrictive regulation, all the way down to the least risky drugs and the least risky regulation. So the first one, medical, prescription, and supervised venues. I've already mentioned this. We have prescribed heroin in a number of countries around the world. Heroin, it's seen as the most dangerous of all drugs. But we do prescribe it, and it's becoming increasingly important because we have synthetic opioids like fentanyl are coming into the heroin supply and killing enormous numbers of people. More than 20,000 people in the US died last year from fentanyl. 20,000 people. From a total overdose death toll of over 70,000. So I think it was 24,000 of those 72,000 were fentanyl. Now that is not, those are poisonings. Those aren't even, people weren't even trying to get fentanyl. They thought they were using heroin. These are poisonings, and they are a direct result of prohibition and illegal supply. Now, some of those people might have died if it was just heroin, but many of them, it's because their drugs were poisoned, and their drugs were poisoned because they were illegal. And that is the result of prohibition. And a regulated supply can reduce those risks. It doesn't eliminate them, but it reduces them. Moving down, the second option we have here is specialist pharmacists. This is like pharmacy-type sales, whether it's from an actual pharmacy or something similar to a pharmacy. It's where you have a trained professional who acts as a gatekeeper to the availability, who can offer advice and can also enforce a code of practice. So, for example, when you go into a pharmacy and you buy drugs from behind the counter, not the aspirin and stuff that you buy in front of the counter, but the behind-the-counter drugs. This might be an appropriate model for some of the sort of medium-risk drugs, powder stimulants, for example. A third option is licensed retailing. This is basically licensed sales. So like when you buy alcohol or tobacco from a licensed vendor. Actually, I don't know whether alcohol and tobacco is licensed in South Africa or not, but it is in many countries. And you can have different levels of regulation around that depending on the environment and depending on the particular drug. A fourth option is licensed sales on premises. So this is basically like a bar. You go into a premises and you can buy the drugs, in this case alcohol, and you can consume it on the premises. Now that may be appropriate for cannabis in the future. So in the Netherlands, for example, they have cannabis coffee shops where you go in and you can buy cannabis and consume it on the premises, a bit like a bar, but for cannabis. And for the least risky drugs, you can have unlicensed sales. You can actually sell some drugs in a supermarket. So I'm thinking of caffeine. So you can buy coffee, but you could maybe also buy coca tea or even poppy seed tea. There are some drugs that need not really much more regulation than these sweeties. And these sweeties are a drug. Sugar is a drug. It kills lots of people. It's really bad for you. It rots your teeth. Remember to brush your teeth. Harm reduction, Sean. They're giving out drugs in this conference. It's outrageous. So the point here is that there are different approaches, different models for different drugs, but we have experience already with many of these models, and we can learn from that and draw upon that. This graphic is an attempt to try and capture the key arguments for regulation. On the y-axis, we can see social and health harms. So the higher up, the more social and health harms you have. And along the bottom, along the x-axis, you have different approaches, a spectrum of different approaches to drug policy. From on the left, ultra-prohibition, sort of hardcore war on drugs. And on the far right, you have legal drugs that are completely unregulated, kind of a commercial free market. So on the far right, that is legal drugs available in supermarkets. Now, our argument is that the place where social and health harms are minimized is actually somewhere between those two extremes, where some things are allowed and some things are prohibited. It's that place in the middle which we call strict legal regulation. And that is the place where advertising and promotion is very, very heavily restricted, where sales to children are not allowed, but adults can access certain key drug products in certain environments. But what this graphic also captures is that whilst we see illegal drugs moving from the far left of this to the middle, we also see some legal drugs that have gone too far on the right historically are also moving back towards the middle. So tobacco control is moving from, on the far right of this graph, where we have very high harms, it's being increasingly well regulated, increasing price, bans on advertising and promotion, bans on smoking in public spaces, bans on public displays. We're not prohibiting tobacco, we're regulating it better, more appropriately for its risk. So the destination is the same. It's the optimal regulation model that minimizes social and health harms. But the destination, the starting point is very different. We have unregulated markets under the war on drugs on the one side for things like cannabis and other illegal drugs, and we have unregulated legal markets on the right of this graph. So it's the same destination, which is minimizing social and health harms, but it's a different starting point. I've included this, just to brief, this is a piece of work that I did with David Nutt, who spoke here last year. And it was really an attempt to provide some data for this graph, because this graph, it's a nice graph, but it's made up. I mean, I think it's true, but I don't have any data for it. But we kind of do now, because what we did was we looked at 4 different models: free market, legal with free markets, legal with strict regulation, state control. This is along the bottom here. Prohibited but with a decriminalization of personal use, and prohibited absolute prohibition, a hardcore war on drugs. So it's a bit like the previous graph, but the other way up. And we looked at which model performed best on a series of different indicators. And I can't talk about this in too much detail. If anyone's interested in reading the paper, I can tell you where it is. It's in the International Journal of Drug Policy. But the point is we actually tried to populate that U-curve with some data on different indicators: health harms, social harms, political harms, economic harms, crime harms. And it came to the same result. So the U-curve which we made up, it seems to be the case that strict legal regulation of drug markets will, generally speaking, deliver the best policy outcomes. And we didn't just do this for cannabis, we also did it for alcohol, and we also did it for heroin. And it came up with slightly different results for each, but essentially the same. Strict government regulation is the optimum policy model on this spectrum. So we don't want absolute prohibition, and we don't want legal free markets, because in both cases you have a lack of regulation. And it's the lack of regulation, whether it's under a legal market or a criminal market, it's the lack of regulation that causes the avoidable harms that we are seeking to reduce through regulation. So I just want to use just a quick example before I wind up. How's my time doing? Okay, I'm just going to keep talking. All day, until you stop me. This is the packaging for cannabis in Uruguay and Canada, the 2 first member states to legalize and regulate cannabis. And these are basically packaged a bit more like pharmaceutical drugs. The idea being to try and avoid the promotional branding that we've seen historically with alcohol and tobacco. Now, not everybody loves these. I see Jules and Myrtle are down there going, no, I don't like it. Not everyone is going to like everything. But, from a public health point of view, this is, I think, a sensible starting point. Because I am interested in the freedom of adults to access drugs and be able to avoid the illegal market and the risks of illegal market and illegal supply. I'm far less interested in the freedom of commercial organizations to promote and brand their products to make money. I'm not interested in the commercial side of this. I'm interested in the public health side of it. And this is some products in the USA. I don't know. This is not all products in the USA look like this, but this is one of the things that's going on. This, for me, is not the right way to do it. I prefer this. Now we can have an argument about this. We can have a debate, and there will be different people come at this from different point of view. In a way, it's the important thing, whether you like this or not. The important thing is, and I've just been in Canada. I was in Canada last week, and some of the industry people were there, the cannabis industry people, and they were complaining. They were saying, "Oh, we can't put our brands and logos." You can actually put your brand. That little green triangle on the right of the Canada one You can put your brand there, but it's quite small. And they were complaining, saying, why can't we have our branding and our lovely packaging and all the rest of it? And they were saying, it's like prohibition all over again. I was going, it is not like prohibition. In Canada, you are going to be able to buy cannabis, a range of different cannabis products in shops. You can buy it online, and you can grow it in your garden and for your own personal use. That is not prohibition. That is a huge step forward from what we have now. And 98% of the world has no access to legal cannabis products at all. So again, we make a choice. These are the kind of decisions we make. And I'm not saying you have to do it one way or the other, but there are choices to make. And different stakeholders in this debate have different perspectives and different approaches. And it may be a case of finding a compromise between different views. There is no policy that will make everybody happy. In terms of the obstacles to change, I mean, obviously there is a lot of ignorance around what regulation is and what regulation means, and hopefully some of the work that Transform's doing can help respond to that. But we do have this, what I've called here, a threat-based narrative of the war on drugs. Michelle yesterday was mentioning that this concept of evil, which is in the UN Single Convention on Drugs. And the war on drugs has often been portrayed as a battle between good and evil. And in that context, a very simple binary division between good and evil, the war on drugs is fighting against evil. So it's almost automatically good. So anything you do to fight evil is good. And we don't need evidence. We don't need to scrutinize and evaluate our policy because we're fighting evil. It's a very difficult thing to get past. The second thing is the conflation of drug use harms and drug prohibition harms. So drugs are risky, and many people may be harmed by their drug use, but there are many harms to do with the criminal drugs market or the poisonings with fentanyl or whatever it is that are prohibition harms. They're not drug harms per se. But they're all mixed up together in the public debate and presented as the world drug problem. This is the drug problem, when actually they're actually problems of the war on drugs are not drugs per se, and we need to separate them so we can have a more intelligent discussion. And the third one is populist political narratives and media sensationalism. Politicians, they love to sound tough, they love to clamp down on drugs, they have to fight evil, they will hype up the threat and then say, we are the response to this threat, we will protect you. And the media as well. The media isn't interested in reporting happy news or good news. The media doesn't report someone had a nice time on drugs yesterday. But they will report someone died on drugs yesterday. And this is part of the problem. All the news we get around drugs is negative. So just some key messaging as I finish up. I think it's important to emphasize the idea of retaking control. It's not about liberalizing or relaxing our drug laws. It's about taking control of a market for risky products that currently we have no control over whatsoever. This is a reassuring concept for the public, and it's a reassuring concept for politicians. Politicians like control. Let's give them some. Also, number one, excuse me, for there's 2 ones there. We regulate drugs because they're risky and not because they're safe. Even cannabis, which may be lower risk, there are some risks for young people, for mental health, for driving, for pregnancy, for your lungs. It's not great if you smoke it with tobacco. We need to be clear what the risks are and that regulation targets those risks and seeks to minimize them. It's because drugs are risky that we regulate them, not because they're safe. The third thing is that regulation is not a silver bullet. It's not a magical solution to all the problems of drugs and the illegal market. Regulation will not get rid of the illegal market altogether. There is an illegal market still for some smuggled tobacco products. There is an illegal market for some homemade alcohol. It doesn't get rid of the illegal market altogether. But it does improve many things on many key indicators: public health indicators, criminal justice indicators, security and development indicators. but it's not a silver bullet. We need to be clear about what the limitations of regulation are, and we mustn't overclaim for what it can deliver. And finally, change towards regulation will be phased and incremental. It will not happen overnight. Different drugs will be regulated in different places over time, and we will probably start with cannabis. I think it's likely, and we will learn from those experiences, and we will make mistakes. And we will learn from those mistakes, and we will move forward, and policy will evolve, and other drugs will move in and be regulated. It's not all going to happen overnight. So it's, again, we need to reassure people that this is a phased increment. We've had the war on drugs for 50 or 60 years. Bringing in regulation is not something that will happen in 1 year. It is a challenge for the next generation. It will be something that we roll out over the next 2, 3, 4, 5, 10, 15 years. So conclusions. Regulation is pragmatic. It deals with reality. There is a critical need to get the balance right, because sometimes different priorities will collide with each other. So if your model is too restrictive, people won't use it, and the illegal market will continue. If your model is too laissez-faire, if your model is not restrictive enough, you start to create space for commercial entities to promote drug use for profit, and that can create its own set of harms. So we need to get the balance right. Tobacco is a good example. If you put the tax rate and price up for tobacco too high, you create smuggling and undercutting and counterfeiting tobacco. If you put it too low, then use may rise. So it's about getting the balance right, and there's no single perfect answer. But what we need to do is we need to move forward in cautious, incremental steps, and we need to follow the evidence. We need to experiment, look at what is working and what's not working. And we need to be flexible, and we need to be willing to change our approach if something's not working. If it's been too open, we need to be more restrictive. If it's too restrictive, we need to be willing to relax it. This is about evidence-based policy. It's not a crazy idea. It's what we do with everything else. Again, I said it's not a silver bullet. It's about taking back control as a way of reducing and managing risk and harms. And finally, it's not just cannabis. The same logic applies to all drugs. However dangerous or risky a drug is, it's more risky and dangerous if it's produced and supplied by organized crime and illegal street dealers. So any drug is safer if it's regulated and by the government and responsible agencies. And I think I will end there. Thank you very much. Enjoy your sweets.